be discussing, right? So let us start with the hemat images first. So this image can be asked in the exam, students. How this image can be asked? What does this show? This, for all of you, is bone marrow needle, bone marrow aspiration needle. You know. Hi everyone, welcome to an extremely important and interesting session where I will be discussing all the pathology images which can be asked in your MCQs. As you all know, students, these days a lot of MCQs in AIIMS, NEET or DNB exams are asked from the images. They give you an image, there will be a clinical history along with that, or just the image, and they will ask you to identify what is this, which cell is this. So this session will help you solve all such questions. Extremely important session. Please be careful. I'll be first starting with the images from hematology. We'll be discussing the images from general pathology, hematology and systemic pathology. What I have tried, students, is the crisp image. I have tried to make it very crisp. So only those images which can be asked in the MCQs I have incorporated, because as you all know, pathology is a very vast subject. So it's not possible to discuss all the images here, but the important ones I will be discussing. Right, so let us start with the hemat images first. So this image can be asked in the exam, students. How this image can be asked? What does this show? This, for all of you, is bone marrow needle, bone marrow aspiration needle. You know, there are two tests which we do, bone marrow aspirate and bone marrow biopsy. So this is a bone marrow aspiration needle. Clear? So if in the exam such a needle is there, this is a bone marrow aspiration needle. Sometimes a question with this image which can be asked is, what are the indications of a bone marrow aspirator biopsy? Indications. All of you know, students, what are the indications of a bone marrow aspirator biopsy? It can be a leukemia, it can be a lymphoma, it can be a myeloproliferative disorder like CML, right? A storage disorder like Gaucher's disease, etc. Right? Then the question which can be asked is, what are the names of these needles? The names. So there are three names which can be there, three types of needles. There is Sala's needle, S-A-L-A-H. There is Klima needle, and there can be Jamshidi needle. Sala's, Klima and Jamshidi. Out of these, Jamshidi has the advantage because it can be used for bone marrow biopsy also. So with the Jamshidi needle, I can do a aspirate also and a biopsy also, right? So this is the name of the needle, Sala's, Klima and Jamshidi. Similarly, students, the next image, if such kind of image is shown, this is also a bone marrow biopsy needle or a bone marrow aspirate needle. Names I have already told you. Clear? Next image, students, very important image. It's a basic thing, and last year students in AIIMS exam, there was a question. They've given the slide, they have marked a cell and asked, what is this cell? So this is a peripheral smear. You should know how a peripheral smear looks like. These are the red blood cells, the RBCs. These cells which you can see, they are the platelets, students. These cells are the platelets. So a peripheral smear with RBCs. These are the platelets. And these are the 5 kinds of WBCs which are there on a peripheral smear. This is a basophil. Please identify. It has bluish granules. A neutrophil. How do we identify? A neutrophil has got 3 to 5 lobes and granules in the cytoplasm. This is a eosinophil. How do we identify? A bilobed nucleus. There is a bilobed nucleus, everybody can see, and brick red granules in the cytoplasm, brick red granules. Then this is a band form, rather. You don't have to. This is a WBC precursor. Then this is a lymphocyte, students, lymphocyte, and this largest cell is a monocyte. Both lymphocytes and monocytes do not have any granules in the cytoplasm. That is how I identify them, and they do not have any granules in the cytoplasm. Lymphocyte is the smallest cell and monocyte is the largest cell in a peripheral smear. Clear? Next, this is how a bone marrow aspirate looks like. Sorry, a bone marrow biopsy looks like. So we have seen how a peripheral smear normally will look like, how a bone marrow biopsy looks like normally. These are the bony trabeculae. When you take a biopsy, these are the bony trabeculae, and these, which you can see, these are the fat cells. This is fat, and this is the cellularity in the bone marrow. This is the cellularity in the bone marrow. Cellularity. So you have fat, you have bony trabeculae, and you have a normal level of cellularity for that particular age. This is how a bone marrow biopsy will look like. Then, what does this form cell, students? This cell shows toxic granules. So in a sepsis patient, students, can you appreciate the granules are thicker and coarser than normal? There are thick and coarse granules than normal. So these are toxic granules which are seen in a patient. They are patches of dilated endoplasmic reticulum. They are patches of dilated endoplasmic reticulum, right? So they are called as Dole bodies seen in sepsis. So in a sepsis patient, the peripheral smear will show two things: toxic granules and Dole. Very important image, students. It has been asked previously in the MCQ exams also, AIMS exam. Which is this cell? This is a lymph node biopsy, and the cell which I see in the center, this cell is called as a Reed-Sternberg cell. This is called as a Reed-Sternberg cell, and the characteristic feature of this cell, students, is it is 15 to 45 microns. It's a large cell with a bilobed nucleus. Large cell with a bilobed nucleus, prominent eosinophilic macronucleoli. Eosinophilic macronucleoli. Can you appreciate? A nucleoli which is pinkish in color. So this is called as eosinophilic macronucleoli, right? And this appearance therefore is called as owl's eye appearance. This appearance is called as owl's eye appearance. And the important point, in most of the types of Hodgkin's lymphoma, this cell is CD15 positive and CD30 positive. So sometimes they ask you a question, students, what are the markers of a Reed-Sternberg cell? CD15 and CD30. Next image, students, this is a lymph node biopsy again. I hope everybody can appreciate the nodular pattern. Can you appreciate these two nodules which you can see? The two nodules. So these are the two nodules which I can see, and the nodules have pinkish area around. So that is sclerosis. So this is actually nodular sclerosis Hodgkin's lymphoma. Nodular sclerosis Hodgkin's lymphoma. How this nodular sclerosis Hodgkin's lymphoma look like? You can appreciate two nodules and a pinkish area around it. All of you know, students, the nodular sclerosis Hodgkin's lymphoma shows lacunar Reed-Sternberg cells, right? So in this RS cell, I hope everybody can appreciate, besides this cell, there is a clear cytoplasm. There is a clear cytoplasm or clear halo around the cell. This is called as a lacunar RS cell. This is called as a lacunar Reed-Sternberg cell because there is a clear space. So what will you see? Nodules surrounded by sclerotic area along with lacunar RS cell, right? Similarly, students, there is another type of Hodgkin's lymphoma which shows a popcorn RS cell. Can everybody appreciate this cell? This cell is shaped like a popcorn. That is why it has been named as a popcorn cell. It has been named as a popcorn cell, and it is a characteristic feature of lymphocyte predominant Hodgkin lymphoma. Lymphocyte predominant Hodgkin's lymphoma, and this cell is CD15 negative, CD30 negative, CD20 positive, CD45 positive, and BCL6 positive. CD20, CD45 and BCL6 positive. Clear? Next image, students. A very beautiful image to show the differences between a lymphoblast and a myeloblast. So this is a patient of AML. This is a patient of ALL. When I see this cell, students, when I see this cell, can you appreciate this cell? It is larger. This cell is smaller. This has moderate cytoplasm. This cell has got moderate cytoplasm. This cell has got scant cytoplasm. Right? This cell, a myeloblast, has got granules. Everybody can appreciate the granules in the cytoplasm. So granules present. Granules present. Here, granules absent. Here, the nuclear chromatin, students, is opened up. Opened up chromatin, and here the nuclear chromatin is coarse chromatin. Coarse chromatin, right? Here, there are 2 to 5 prominent nucleoli. Everybody can see 2 to 5 prominent nucleoli. Here, there are either no to up to 2 nucleoli. Sometimes you can see 1 or 2 nucleoli. Here you have 2 to 5 prominent nucleoli. Clear? So this is how we differentiate a myeloblast from a lymphoblast. Next, another image showing lymphoblasts ALL. These cells are not normal. Everybody knows that these are precursor cells or immature cells or blasts. These are all blasts, right? So this is a lymphoblast because this has a scanty cytoplasm, no granules in the cytoplasm, a dark purplish coarse chromatin, and no prominent nucleoli, right? Similarly, students, this is a lymphoblast. This is basically a pass positive slide. Lymphoblast, all of you know that lymphoblasts are pass positive and myeloblasts are myeloperoxidase, non-specific esterase or Sudan black B positive. So we can see this cell is a lymphoblast which shows pass positivity, and this is called as block positivity. This is called as block positivity. Clear? This is a lymphoblast showing pass positivity. Next image, students, these are the RBCs. This is a peripheral smear. These are the lymphocytes. These are the normal looking lymphocytes, and these cells, students, these are basically smudge cells. Another name for smudge cell is a basket cell, and another name is a parachute cell. Smudge cell or basket cell or parachute cell, which is a characteristic feature of students CLL. Again, this image can be asked in the exam. It's a characteristic feature of chronic lymphocytic leukemia. Can be asked in the exams. Next image, students, very important, have been previously asked in the exam. This is a lymph node biopsy, students, and this lymph node biopsy shows a starry sky appearance. It shows a stars in the sky appearance, starry sky appearance. Can you appreciate these cells in the middle? So these blue color lymphoid cells. Lymphoid cells, these blue colored lymphoid cells, they form the sky. They are the sky, and these cells which are whitish open, they look like the stars. And what are these cells? They are histiocytes. They are histiocytes or macrophages, and these are the stars. So this is stars in the sky appearance, which is a characteristic feature of Burkitt's lymphoma. Right? This is a characteristic feature of which lesion? Burkitt's lymphoma. Clear? Next image, students. In this image, peripheral smear, I can identify two things. One, this RBCs arranged one after another. This is called as rouleau. Rouleau is a characteristic feature of multiple myeloma. RBCs arranged one after another, and this is a hairy cell. Can you people appreciate hair-like projections in the cell? So this is a hairy cell. Next, now this is how a normal plasma cell looks like. Very important. A normal plasma cell. This is a oval shaped cell. Can I see it's a oval cell? This cell has got a eccentric nucleus. This cell has got a eccentric nucleus on one side, right? And cartwheel chromatin. Cartwheel chromatin. You know, it's very difficult to appreciate cartwheel chromatin. Why do they have given this name? Because the chromatin looks like a bullock cart wheel. That is why cartwheel chromatin. Very important feature is a perinuclear halo. A perinuclear halo. So outside the cell, there is an open space or a perinuclear halo, empty space, which is called as a perinuclear halo. Right? So this is how a normal plasma cell looks like. And plasma cell excess will be seen in multiple myeloma. Right? Next image, students. Again, what is this image showing? I have already told you something like this. Rouleau formation. Rouleau. Next, this is a bone marrow aspirate. This is a bone marrow aspirate. I can see different types of cells, right? In this aspirate, which cells are increased, students? This cell, all these cells are increased in this slide, right? All these cells are increased, and just now I told you, students, what are these cells? What are these cells? These are all plasma cells. So this is the bone marrow aspirate of a patient with multiple myeloma. Bone marrow aspirate of a patient with multiple myeloma, where there will be increased number of plasma cells. Clear? So this is how it looks like. Next image. Again, a very important image, students. This is also bone marrow aspirate. I can see this cell, right? This is a plasma cell because it has an eccentric nucleus and a beautiful perinuclear halo, right? In this cell, I can see these inclusions. Can you appreciate these inclusions? In the cytoplasm. So these are cytoplasmic inclusions. These are intracytoplasmic inclusions, and these inclusions are called as Russell bodies. Again, students, these inclusions are seen in a patient with multiple myeloma, intracytoplasmic inclusions, because of excess immunoglobulins, right? These are Russell bodies. Similarly, students, in this slide, all these cells which are there, this cell, these, all these are plasma cells. They are plasma cells because of the reasons which I have already told you. And in this slide, these plasma cells have got inclusions in the nucleus. That is why they are intranuclear inclusions, and these intranuclear inclusion, students, are called as Dutcher bodies. Again seen in multiple myeloma. So Russell bodies and Dutcher bodies. Russell bodies seen in multiple myeloma, Dutcher bodies seen in multiple myeloma. This is another cell. I have identified this is also a plasma cell, and this has a lot of inclusions in the cytoplasm, but these inclusions look like a cluster of a grape-like cluster. That is why this is called as a mort or a morula cell. This cell is called as a mort cell or a morula cell, again a characteristic feature of multiple myeloma. This is the X-ray skull. It shows a X-ray skull, and in this X-ray skull, students, you can see these multiple lytic lesions. So in this X-ray skull, I can see multiple lytic lesions, and these lytic lesions are also seen in a patient with multiple myeloma. These lytic lesions are also seen in a patient with multiple myeloma, right? Next image, students. Again, this is the peripheral smear. I can see these are large cells with moderate cytoplasm, granules in the cytoplasm, a open chromatin, prominent nucleoli, open chromatin, prominent nucleoli. So what cells are these, students? These are myeloblasts seen in AML. These are myeloblasts seen in AML, acute myeloid leukemia. Next image, very interesting, students. Again, this can be a spotter in the exam. Can you appreciate the cytoplasm of this cell has got a large number of rod-like structures? These are basically OR rods, and because this cell has a lot of OR rods, this cell is called as a fagot cell. This cell is called as a fagot cell. What is a fagot cell? It has a bunch of OR rods. That cell is called as a fagot cell, right? This is a characteristic feature of AML M3 or acute promyelocytic leukemia. Now, this is again a bone marrow aspirate, students. In this bone marrow aspirate, I can see large number of different types of cells, right? Sorry, this is not an aspirate, in fact, this is a peripheral smear. In this peripheral smear, I can see all stages of white blood cell maturation. Ideally, on a peripheral smear, you do not see all stages of peripheral WBC or RBC maturation. In a peripheral smear, you see only mature cells, and in a bone marrow aspirate, you see both mature and immature cells, right? This is a peripheral smear which shows cells in all stages of maturation. Like this is a band form. This is a eosinophilic precursor. Again, a band form. This is a myeloblast. So you have different types of cells. All stages of myeloid maturation plus basophilia. Plus basophilia is a characteristic feature of CML. It is a characteristic feature of chronic myeloid leukemia or CML, right? In this slide, this is a bone marrow biopsy. And in this bone marrow biopsy, students, you can see a lot of blackish thing which is there. Can you appreciate these black colored fibers? Can you appreciate these black colored fibers? So this is a bone marrow biopsy which shows myelofibrosis, bone marrow fibrosis. Fibrosis in the bone marrow stained with silver stain. Anything which is stained with silver stain shows black in color, right? So this is myelofibrosis. This is a peripheral smear with a bilobed neutrophil. Can you appreciate? This neutrophil has got two lobes. It's a bilobed neutrophil, and this neutrophil specifically is called as pseudo-Pelger-Ewart cell. This is student specially called as pseudo-Pelger-Ewart cell, which can be seen in myelodysplastic syndrome, MDS, myelodysplastic syndrome, right? Then this is the electron microscopy of a patient. This is the electron microscopy. Any black and white picture is an electron microscopy. And in this electron microscopy, I can see this. This shows tennis racket appearance. Tennis racket appearance. Tennis racket appearance or Burbeck granules. Tennis racket appearance or Burbeck granules, which are a characteristic feature of Langerhans cell histiocytosis. Again, this image can be asked in the exam. The electron microscopy of Langerhans cell histiocytosis shows tennis racket appearance or Burbeck granules. Peripheral smear. This cell is a bite cell. This is a bite cell. And these greenish bodies which you can see, they are Heinz bodies, and both these features are a characteristic feature of G6PD deficiency, glucose 6-phosphate dehydrogenase deficiency, right? Heinz bodies and bite cells. Clear? Next image, students. This cell, this is a sickle cell. This is a sickle cell, we can appreciate. This image shows two things. One, teardrop cell. Teardrop cell is seen in myelofibrosis. Teardrop cell is seen in myelofibrosis. Right? So this is basophilic stippling. What is basophilic stippling, students? RBC with bluish dots inside it, right? And this basophilic stippling is a characteristic feature of lead poisoning. So two things in RBCs which we have seen in this slide: teardrop cell and basophilic stippling. Next, this arrow wala cell is basically a target cell. Target cell is a characteristic feature of what? Thalassemia, right? Target cell is a characteristic feature of thalassemia. Can also be seen in liver disease, iron deficiency, anemia. This cell again can be asked in the exam. This is a hypersegmented neutrophil. Can you people appreciate this neutrophil has got multiple nuclear lobes? 1, 2, 3, 4, 5, 6, right? Normally I have told you any neutrophil has got 3 to 5 lobes. This has got multiple lobes. This is a hypersegmented neutrophil, which is a characteristic feature of megaloblastic anemia due to vitamin B12 deficiency, folate deficiency, etc. Right? Next, this image, students. This is a bone marrow biopsy. It's a bone marrow biopsy. How do I know? These are the bony trabeculae. These are the bony trabeculae. And this biopsy shows a large amount of fat and very less foci of cellularity. Large amount of fat, very less foci of cellularity. So this is the bone marrow biopsy of a patient with aplastic anemia. Bone marrow biopsy of a patient with aplastic anemia, right? Next, extremely important image can be asked in the exams. This is something which is called as reticulocytes. Reticulocytes. So this cell, these reticulocytes are precursors of RBCs. These cells are reticulocytes and they are stained with supravital stains. They are stained with supravital stains like brilliant crescile blue, like brilliant crescent blue or new methylene blue. They are stained with supravital stains like brilliant crescent blue or new methylene blue. And this bluish meshwork is due to RNA or ribosomes. This is a mature RBC. Clear? This image shows all the different types of RBC, students. This is a normal cell, a smaller RBC, larger RBCs. How do we grade hypochromia? A target cell. Spherocyte is smaller with no central pallor. Ovalocyte is oval. Stomatocyte has a elliptical space in between. Sickle cell, teardrop. Burr cell, characteristic feature of uremia. Fragmented red cell. Acanthocytes with spicules. Cabot ring seen in megaloblastic anemia. Basophilic stippling I've already shown you. Howell Jolly body is a remnant of DNA seen in post-splenectomy patients, right? Last hemat slide, students. This is also a bone marrow aspirate. In this aspirate, you can see erythroid precursors. These are all erythroid precursors. These erythroid precursors have got, you know what is a sieve? Sieve is a chalni, right? Erythroid precursors with immature chromatin, which is called as sieve-like chromatin. And this sieve-like chromatin is a characteristic feature of megaloblastic anemia. Megaloblastic anemia due to vitamin B12 or folate deficiency. Clear? Now let us see a few images from general pathology, students. This image is a gross specimen of a liver. This is gross specimen of a liver, and in this gross liver, students, I can see this area. This is a white infarct. I can see this is a white infarct or an area of coagulative necrosis, right? What is an infarct? An infarct is an area of ischemic or coagulative necrosis. This is white infarct or coagulative necrosis. Similarly, students, this is brain, and in this brain, I can see this area. I can see this area. This is liquefactive necrosis in the brain tissue. Liquefactive necrosis. Clear? Then, in this image, students, this is the specimen of a lung. Gross specimen of a lung. At the apex, I can see this area. At the apex, I can see this area. This is an area of caseous necrosis. Caseous. It has a cottage cheese-like appearance. Caseous necrosis. This image, students, it's a blood vessel. Why do I say it's a blood vessel? Because you can see these RBCs in the middle. Everybody can appreciate RBCs in the lumen, right? And all of us can appreciate this pinkish line around the blood vessel, this pinkish line. So this is what we call as fibrinoid necrosis. This is fibrinoid necrosis in the vessel wall. Clear? Then extremely important image, AIMS 2017, this was a question. An image like this was shown. What is the C line, students? B and C line. This is smear pattern seen in necrosis. Smear pattern because it looks like a peripheral smear. And this A image, this is actually electrophoresis. This is actually electrophoresis, students. Electrophoresis. Which electrophoresis? DNA electrophoresis, right? The A image shows a step ladder pattern. Step ladder pattern, and step ladder pattern is seen in apoptotic cells. Apoptotic cells shows a step ladder pattern. Why? Because of endonuclease property, and the necrotic cells shows a smear pattern. It looks like a peripheral smear. Next image, students, this thing which I see here, the brownish pigment, everybody can appreciate. Which is this pigment? Any golden brown or brown pigment. Any brown pigment. A brown pigment can be either lipofuscin. On a slide, it can be either lipofuscin or it can be hemosiderin. Either lipofuscin or hemosiderin, right? So, if the patient is an aging patient, you will mark it as lipofuscin. If there is a history of iron overload, you will mark it as hemosiderin. Again, students, this is a brownish pigment which I can see. This is also either hemosiderin or lipofuscin. This is a slide which shows this blue staining. So, hemosiderin or iron on a Prussian blue stain turns blue. It shows a bluish granular color. So, this is Prussian blue staining showing granular blue thing, right? This is hemosiderin or iron. Next image, students, the last pigment, the image of which can come in the exam. This image all of you can appreciate. It's a black colored pigment, and a black colored pigment is a melanin. So any black colored pigment is a melanin. Next image, students, the arrow thing, that is this thing, this or this, these arrowed things are basically Samoma bodies. These arrowed things, they are basically Samoma bodies. Clear? What are Samoma bodies? They are foci of dystrophic calcification. Next image, students, again this is hemosiderin, brownish pigment. Next, very important, has been asked in AIIMS exam 2 years back. This is a specimen of liver. In this liver, you can appreciate the surface is not smooth. It has got brownish spiculated things. So this looks like a nutmeg. It looks like a nutmeg. That is why this liver is called as nutmeg liver. Nutmeg liver because it looks like a nutmeg. Then this is the gross specimen of a lung, students, and this is basically red infarct. You know, infarct is of two types, red and white. White infarct is an area of coagulative necrosis, I have already shown you. This is red infarct in lung. This image, students, it's a biopsy. In this biopsy, I can see there are dysplastic cells. There are dysplastic cells which are present. Why these cells are dysplastic? Because they have a high NC ratio, they are hyperchromatic, there is loss of polarity, but the basement membrane is intact. Basement membrane is intact. That is why this is the slide of carcinoma in situ. This is the slide of carcinoma in situ. Clear? Next image, students, extremely important, lymph node biopsy. This is a lymph node biopsy. In this lymph node biopsy, these cells, can you appreciate, students? These cells have a very stretched out nucleus. These are what we call as epithelioid cells. What are epithelioid cells? They are activated macrophages. They have a slipper shaped nucleus, and what we see this nodule, this is a granuloma. This nodule is a granuloma. Clear? Then again a very interesting slide. This is a lymph node biopsy which shows, students, 1, 2, 3. 3 granulomas. They have slipper shaped nucleus. So what are the components of a granuloma? One component of a granuloma, epithelioid cells. You can see some cells which have a slipper shaped nucleus. These cells are epithelioid cells. They are surrounded by a collar of lymphocytes, right? They are surrounded by a collar of lymphocytes. In this, you can appreciate this is a collar of lymphocytes, and sometimes there are giant cells. These are the giant cells which are a component of a granuloma. Giant cells, right? Next image, students, very important, can be asked in the exams. A A kidney biopsy, this is a glomerulus, this is amyloid. All of you know amyloid on Congo red under polarized light shows apple green birefringence. So this is apple green birefringence of amyloid, apple green birefringence. Similarly, the same thing, students, apple green birefringence of amyloid, Congo red under polarized light. This is the best stain for amyloid. Now, this is a spleen, students. In this spleen, you can see a lot of these whitish granules, right? These whitish granules, they look like sago grains or sabudana. This is called as sago spleen. You know, when follicles are affected, it leads to sago spleen, and when splenic sinuses are affected, it produces large geographical map-like areas, and that is called as lardaceous spleen. Large geographic map-like areas called as lardaceous spleen. Then this is what we call as a karyogram, examiner's favorite image. Arrangement of chromosomes in descending order of length. These are the chromosomes in descending order of length, followed by sex chromosomes. The last pair, students, is either XX or XY. The last pair is either XX or XY. Right? So this is a karyogram. This is a karyogram with trisomy 13, and trisomy 13 is Patau syndrome. Patau syndrome. Clear? This is a karyogram with loss of this chromosome. So this is Turner syndrome. Whenever you get a karyogram, first you have to number the chromosomes, and then you have to see what abnormality is there on that particular position. Next, trisomy 18, Edwards syndrome. Next, trisomy 21, Down syndrome. Here, what they have? 2 X chromosome and 1 Y. So there is Klinefelter syndrome. This is examiner's favorite topic, Klinefelter syndrome. Next, deletion of a part of 5th chromosome. This is Cry-Du-Chat syndrome. Cat like cry, del 5p, right? Which genetic technique is depicted here? Answer is fluorescent in situ hybridization, fish. Which genetic technique is depicted here? Answer is microarray, microarray. Very important, students, Gaucher's disease. This cell, beautiful cell which all of you can see, this is a Gaucher's cell. What is a Gaucher's cell, students? As you can appreciate, it has a crumpled tissue paper appearance of cytoplasm. Wrinkled tissue paper appearance, this is a Gaucher's cell. Then again, this is a Reed-Sternberg cell which has a owl's eye appearance. And why I have seen viral infections, you know, if a patient has viral infections, it has got owl's eye inclusions. Owl's eye inclusions. So 2 owl's eye in pathology. Owl's eye, Reed-Sternberg cell, Hodgkin's lymphoma. In viral infections, there can be owl's eye inclusions, right? This is a slide showing a beautiful thing which you should know, examiner's favorite. These things which you can see, cells arranged around a central space. All of you can appreciate. There is a central empty space and cells are arranged around that. These are called as rosettes. These are rosettes because they look like a rose or a flower. They are called as rosettes because they look like a flower or a rose, right? And this is a small, round, blue cell tumor of childhood. Small brown blue cell tumor of childhood showing rosettes or rose-like structures. Clear? These are the few images from general pathology that we have. Now let us start with a few images from systemic pathology, students. First of all, slide showing curved bacilli at the apex. This is a stomach biopsy, students. Stomach biopsy. In fact, we take an antral biopsy in case of H. pylori. Very difficult to visualize the H. pylori on HNE. These bacilli which you can see, this is H. pylori. This is H. pylori which is stained with Wharton starry silver stain. This is H. pylori which is stained with Wharton starry silver stain. Anything with silver stain is black in color. Black in color. That's why this is black. Then this is also a stomach biopsy. Stomach biopsy, and these cells which you can see, these are all signet ring cells. Everybody can appreciate? A cell has got a cytoplasm and a ring-like structure. This is a signet ring cell. The nucleus is pushed to the periphery. Why? Because of intracellular mucin. Because of intracellular mucin, nucleus is pushed to the periphery. This is a signet ring cell. Then this is what is called as Leionitis plastica. Leionitis plastica, that is the last stage of gastric adenocarcinoma, where the stomach has a leather bottle appearance. Leather bottle. It appears like a leather bottle, so it is called Leionitis plastica, the last stage of stomach cancer. Next image, students, again a gastric biopsy, and what you can see, these cells arranged in nests or cords. What are these cells? This is carcinoid. I'll tell you other important features of carcinoid. The other important feature is the cells have got salt and pepper chromatin, right? Extremely important. All the neuroendocrine tumors in the body, all neuroendocrine tumors, carcinoid tumor, medullary carcinoma of thyroid, pheochromocytoma, all of them have got salt and pepper chromatin. So suppose you mix salt and pepper, it looks like this. So you can appreciate such a chromatin here. So they have salt and pepper chromatin, right? Remember, that is carcinoid tumor. This slide, students, an interesting slide, can be asked in the future exams. Celiac disease. I can appreciate in this slide, I can see these villi. These are the villi which are there. Here you have atrophic villi. There is villus atrophy, right? Second thing which happens in celiac disease is crypt hyperplasia. There is crypt hyperplasia. And the last thing which happens is increased IELs, intraepithelial lymphocytes increased, right? So that is celiac disease. Clear? Next, this image, students, again intestinal biopsy. This intestinal biopsy shows these cells in the lumen. This is what we call as Whipple's disease. These are basically macrophages. These are macrophages in the lumen, Whipple's disease. These macrophages are characteristically PAS positive. Foamy macrophages which are PAS positive, characteristic feature of Whipple's disease, right? Next image, students, Crohn's disease. In Crohn's disease, I can see this is basically a normal intestinal gross, right? Here you have a mucosa which looks like a cobblestone. So you have cobblestone appearance of mucosa, and this cobblestone appearance of mucosa is a characteristic feature of Crohn's disease. It's a characteristic feature of Crohn's disease. Now, Crohn's disease shows a granuloma. This is a granuloma. Ulcerative colitis does not show a granuloma. Ulcerative colitis shows crypt abscess. What is a crypt abscess? Inside the crypt there will be a lot of neutrophils. So lot of neutrophils inside the crypt, a neutrophilic aggregate, it is called as a crypt abscess, right? And there is also cryptitis which can be seen. What is cryptitis? A neutrophil in the crypt epithelium, that is called as cryptitis. Next image students, again showing cryptitis and crypt abscesses. Now this image was asked in the AIIMS exam a few years back. What is this called? This is a polyp. Can you appreciate the shape? This is a polyp. Polyp is a finger-like projection. It's a protrusion of the mucosa, right? And in this polyp you can see a lot of these glandular structure. So this is usually a adenomatous polyp. You can see a lot of glandular structure. So this is an adenomatous polyp. And this is a villous polyp. Can you appreciate villi-like structures? This is a villous polyp. This image shows these cells. These cells are basically Giardia lamblia. Can you appreciate these cells? These are not cells, this is a microorganism in the lumen. This is Giardia lamblia. Clear? Next, if I show you some slides of liver students, in liver, this is what we call as fat. So steatosis will look like this, steatosis or fatty change. There are neutrophils infiltrating the liver biopsy. Maillary bodies, I'll show you a better picture here. Sorry, it will come. These liver cells, they are called as ground glass hepatocytes. You will be given a history, I'm sure you will be given a history in the exams, right? So you will be able, and such an image might be given. These are ground glass hepatocytes which are a characteristic feature of hepatitis B infection, liver biopsy in hepatitis B. This image shows these structures, pinkish structures. Now hyaline means pink in color. These are called as Mallory hyaline bodies. These are called as Mallory hyaline bodies, characteristic feature of alcoholic liver disease, histopathology. What are Mallory hyaline bodies? They are composed of intermediate filaments like cytokeratin 8 and 18. This image shows a liver biopsy. Can all of you appreciate these brownish granular thing which is there? The brownish granular thing which is there. In a liver biopsy, granular brownish thing is usually hemosiderin, because liver biopsy might have iron accumulation, hemochromatosis. And hemochromatosis, I have already shown this slide. Hemochromatosis in a liver biopsy will stain with Prussian blue stain. So Prussian blue stains the hemosiderin or iron, which will appear like this, bluish granular. This is, I have already told you students, image showing something like nutmeg liver. Nutmeg liver is seen in chronic venous congestion of liver. CVC of liver shows nutmeg liver, right? Next, very important students, this image shows a skin biopsy. It's a spotter which is asked. Can you appreciate these cells? On high power, they will appreciate like this. This is molluscum contagiosum. This is molluscum contagiosum. Molluscum contagiosum on a skin biopsy. Just remember this image because it can come as a spotter. Next, this. Now, this is a skin biopsy. You will be given a history of a skin biopsy. And in this, can you appreciate something, a bullous disorder? There is a bullous disorder. There is a bulla. And this bulla is basically suprabasal. It is just above the above the basal layer. This is a suprabasal bulla, which is a characteristically seen in. This suprabasal bulla is characteristically seen in pemphigus vulgaris. It is characteristically seen in pemphigus vulgaris, and this appearance, students, is called as row of tombstone appearance. It looks like a row of tombstone, so this is called as a row of tombstone appearance. Similarly, students, in this slide there is a in fact, students, in this slide the bulla is not suprabasal. The bulla is just here the bulla is suprabasal. In this image the bulla is below the epidermal layer, so it is subepidermal bulla. Subepidermal bulla, and this subepidermal bulla is seen in bullous pemphigoid. It is seen in bullous pemphigoid, right? Then here, this is a very important image, students. This is central nervous system. So you get a CNS biopsy, history of a patient. What does this show? Characteristically, students, fried egg appearance. Two fried eggs in pathology, students. Oligodendroglioma. It's a brain tumor. So oligodendroglioma and hairy cell leukemia bone marrow biopsy shows a fried egg appearance. So two fried egg appearance, oligodendroglioma and hairy cell leukemia bone marrow biopsy. Oligodendroglioma also shows chicken wire blood vessel. Can you see this blood vessel? It's chicken wire blood vessel. They are stretched out blood vessels. It is called as chicken wire. Stretched out blood vessels called as chicken wire. This image has been asked in AIIMS exam previously, students. Extremely important. The biopsy of a schwannoma. Schwannoma. So a schwannoma shows three areas, students. The hypercellular area. Can you appreciate there are a large number of cells here? So the hypercellular area is called as Antony A pattern. Antony A pattern. Antony A. This area is a little hypocellular. Hypocellular. This area is called as Antony B pattern. Antony B pattern. And in between these two areas, students, there are these empty spaces. These empty spaces are called as Verroque bodies. These empty spaces are called as Verroque bodies. So Antony A, hypercellular, Antony B, hypocellular. Spaces in between the empty spaces, Verroque bodies. Next image, students, again a small round blue cell tumor. Can you see sheets of small round blue cells with scanty cytoplasm? Do not get confused. You will definitely get a history in these questions, right? History, at least they will tell you which biopsy is there. And I've already told you and showed you these slides. These are what we call as rosettes, beautiful rosettes. Tumor cells arranged around a central area, central space. So these are what we call as rosettes. It's a small round blue cell tumor. Clear? Let us see the next image, students. So this is an image of a cervical biopsy from the cervix. As you can see, a very important cell, and this has been asked previously in the exams, coilocytes. What are coilocytes, students? Coilocytes are cells, they are squamous cells which have got a thick raisin-like nucleus. They have a thick membrane and a raisin-like nucleus with a perinuclear halo. All these cells which you can see here, they are called coilocytes. And coilocytes are characteristic feature of human papilloma virus infection, HPV infection. As in this slide, I can also see cells which have got coilocytes. They have a raisin-like nucleus with a halo, perinuclear halo. In all these cells, there is a central raisin-like nucleus with a empty space around, that is a perinuclear halo, right? And characteristic feature of HPV. Next, this is, students, a testicular biopsy. This is a biopsy from the testis, testicular biopsy. The characteristic feature is cells which are arranged in nodules. Okay. One is the cells are arranged in nodules. cells arranged in nodules. These nodules are separated by fibrous septa. We can appreciate the fibrous septa. So, nodules separated by fibrous septa, separated by fibrous septae. These nodules, right? In between there are seminoma cells. In between there are cells which are called as seminoma cells. Very important feature is the septae are infiltrated by lymphocytes. The fibrous septae are infiltrated by lymphocytes. These septae have got a large number of lymphocytes. So, this is basically the slide of a patient with seminoma. Clear? Next, this structure is what we call as a Schiller dual body. It looks like a glomerulus. Basically parietal and visceral layer around a blood vessel. I can see a blood vessel, how RBCs, 2 layers. It is a Schiller dual body, which is a characteristic feature of yolk sac tumor. This is a characteristic feature of yolk sac tumor or endodermal sinus tumor. This is also a testicular or ovarian and it shows a teratoma. If you get a history of a testicular or ovarian tumor, this is a teratoma. Because there are derivatives of different germ layers. You can see these are glands. This is like the follicles. This is epithelium. This is sebaceous gland. This is the neural element. So, there are derivatives of all 3 germ layers, ectoderm, mesoderm, endoderm. This is a teratoma. Now, here this is a spotter, Rinke's crystals. These crystalline structures, they are Rinke's crystals, which are a characteristic feature of Leydig cell tumors. They are a characteristic feature of Leydig cell tumors, Rinke's crystals. This image, students, this is basically from thyroid, right? This is a thyroid mass. You can see normal thyroid follicles filled with colloid. Everybody can appreciate. In these follicles, you can see these lymphoid aggregates. These lymphoid aggregates should not be present on a thyroid mass. These lymphoid aggregates. So, when there are lymphoid aggregates or lymphoid stroma, it is basically lymphoid aggregates. It is basically Hashimoto's thyroiditis. Hashimoto's thyroiditis. Hashimoto's thyroiditis. Next, in Hashimoto, another characteristic feature is the Hurdle cells. So, 2 very important things which you are see. One is a lymphoid aggregate or lymphoid cells. Another is Hurdle cells. What are Hurdle cells? Cells with abundant eosinophilic granular cytoplasm. These are all Hurdle cells. Another name for them is oncocytic change, oncocytes, right? Next, this is basically from thyroid. When you have this is a papillary cancer. I'll tell you all the features pathological have been asked in the MCQ exam previously. A papillary cancer thyroid shows papillae. What is a papillae, students? It's a finger-like projection with a fibrovascular core. I can appreciate these blood vessels in the center, fibrovascular cores, right? Next image shows orphan Annie eye nuclei, orphan Annie eye nuclei, right? So, the cells have, the papillae have got cells which have got clear cytoplasm, clear nucleus. Can you appreciate? This has been compared to a cartoon character called as Little Orphan Annie. The cartoonist forgot to put any pupil in the eye. So, this is Little Orphan Annie, this is Orphan Annie eye nuclei, right? Then, also in a papillary cancer, you see coffee bean nuclei. There is a groove in the nucleus, coffee bean nuclei, nuclear grooves are there. Then there are nuclear pseudo-inclusions. There are nuclear pseudo-inclusions. Nuclear pseudo-inclusions. So what all I can see in papillary carcinoma microscopically? Papillae, orphananii, coffee bean, inclusions and samoma bodies, which I have already shown you. This is medullary carcinoma of thyroid, students. If this is a thyroid, the history will be given. Can you appreciate this pinkish material, a lot of pinkish material which is there? This pinkish material is basically amyloid. This is how a normal glomerulus looks like, students. These are the tubules. These are the tubules. This is how a normal glomerulus look like. A normal glomerulus has got 1 or 2 cells per capillary tuft. These are the capillary tufts. There are 1 or 2 cells per capillary tuft. Capillary lumens are open. Thickness of glomerular capillary wall is similar to that of tubular basement membrane. So thickness of this wall is similar to that of tubular basement membrane. So I can compare whether it is more thick or less. The mesangial cells and mesangial matrix are located in the stalk or the central region, right? Like these. Any variation from this is abnormal. What all lesions can you see? See, this is a glomerulus. Can you appreciate this pinkish material? This doesn't look normal, this pinkish material. What is this pinkish material, students? This is glomerulosclerosis. Can you see a lot of sclerosis pinkish material? In kidney, 2 kinds of pinkish material can be there. Either hyaline, amyloid or sclerosis. This is glomerulosclerosis. This is thickening of tubular basement membrane. Can you see thick tubular basement membrane? On pastine. This image stores nodular glomerulosclerosis. Can you appreciate these nodules, pinkish nodules? This is nodular glomerulosclerosis, also called as Kimmel-Steele-Wilson lesion, which is a characteristic feature of diabetic nephropathy. It is a characteristic feature of diabetic nephropathy, Kimmel-Steele-Wilson lesion, right? Next, another very interesting slide, students, a kidney biopsy showing 2 glomeruli, and this shows this lesion different from this part different from this. What is this, students? This is a crescent. So this is crescent as a half moon. I can appreciate half moons being present. Rapidly proliferative glomerulonephritis or crescentric glomerulonephritis. Crescentric glomerulonephritis or rapidly proliferative glomerulonephritis. Next, this image again showing nodule, students. Can you see? Glomerulosclerosis, diabetic nephropathy. Kidney with multiple cysts, I can see. So what it will be, students? Gross specimen, adult polycystic kidney disease, PCKD. Kidney tumor, very easy. It's a clear cell carcinoma, renal cell carcinoma, clear cell. Can all of you appreciate these cells which are totally clear? So this is a clear cell renal cell carcinoma, right? Clearing is because of glycogen. That is why these cells are PAS positive. This is a heart. This image was asked in the last year AIIMS exam. When you stain heart with triphenyl tetrazolium chloride, when I stain the heart with triphenyl tetrazolium chloride, right, the normal area shows red color while the infarcted area shows a pale or yellow color. Infarcted area shows a pale or yellow color, normal area shows a red color, brick red color rather, brick red. Okay, this is a blood vessel. There are a lot of RBCs. This is hyaline arteriosclerosis, pinkish material. This is hyperplastic arteriosclerosis showing onion skin appearance, onion skin. Hyaline arteriosclerosis is seen in benign hypertension, whereas hyperplastic arteriosclerosis is seen in malignant hypertension, right? Different types of vegetations on the heart. Rheumatic heart disease, small warty vegetations along the line of closure. Infective endocarditis, large friable vegetations. They are friable. They are destructive. They can destroy the chordae tendineae. Friable destructive vegetations along the line of closure. NBTE, multiple scattered vegetation. Liebman-Sachs endocarditis seen in SLE shows vegetations on both sides of valve leaflets. Both sides of valve leaflets, right? Next image, students, this is a lung biopsy, sputum biopsy showing Kirschmann spirals. This is a Kirschmann spiral. This can be asked in the exam. These bodies, they are called ferruginous bodies or asbestos bodies. Iron, asbestos particles coated with iron, ferruginous bodies or asbestos bodies. A lung tumor showing keratin pearls, right? These are keratin pearls. So any tumor in the body showing keratin pearls is a squamous cell carcinoma. Squamous cell anywhere in the body will show keratin pearls. Right, this is, can you appreciate in this biopsy, this is also an alveolar biopsy, tumor cells grow along the bronchoalveolar lining. Tumor cells grow along the bronchoalveolar lining, along bronchoalveolar lining. So this is basically a bronchoalveolar carcinoma of lung. Bronchoalveolar carcinoma of lung, which shows a lipidic or a filigree pattern. Next, adenocarcinoma anywhere in the body will show such a picture. Adeno means glands. So there will be glands lined by malignant cells. Glands lined by malignant cells. Clear? And last image, students, this is the electron microscopy of mesothelioma. It's a mesothelioma which shows, can you appreciate these? It shows long, slender microfilaments, microvilli. Long, slender villi or microfilaments, right? So these are the important pathology images which can be asked in your MCQs. Hi everyone, I'm Dr. Ila Jain Khandelwal this side. Welcome to the live session for pathology questions. Now before I start, I would sincerely apologize to all of you for a few technical glitches which happened in the beginning. And thank you so much for your patient listening, students. Now a few things I would like to clarify, students. The first is, most of the students had this question that will this video be available on the Marrow app? Yes, this video will be available to all the Marrow users soon, and most of the Marrow users soon, and I promise that this video will be released before the AIIMS exam. So be rest assured this will be available. Second thing, most of you had this question, how to solve the image-based MCQs. Students, for general pathology and hematology, you can get direct questions, like you can be given a spotter, you can be given a slide, and you will be asked how to spot that particular cell. Yeah, which particular cell is that? But be rest assured, for systemic pathology, what the examiner will do, the examiner will give you a history, and 80% of the questions you can solve from systemic pathology or even hematology by the history of the question. So do not worry about that, students. Do not worry about that. You can solve most of the questions of systemic pathology by the history, right? Next important thing, yes, for general and hemat you can be given a spotter, because these days the examiner wants to test your basic knowledge, and peripheral smear and bone marrow examination you see in your MBBS exams, MBBS days. That is why the examiner has a tendency to show you a peripheral smear or a bone marrow aspirate. Next thing which I would like to clarify, students, is that I have deliberately tried to make this a very quick session, because the theory related to these questions will be seen in the, you can see that theory in the videos which are available on the Marrow app. So be rest assured, the entire theory related to these images is there on the Marrow app. Any other relevant questions regarding pathology preparation or these images, you can ask me now. Okay, somebody has asked me a question, what to study before exam, what to revise on the last day. I would sincerely advise you not to force yourself. Don't think that if you study one day before the exam, you will be able to crack the exam. No, that does not happen. In a MCQ exam, for a MCQ exam, it requires a preparation for a long period, right? So 2 to 3 months before the exam is a very critical period. Just on the last 2 days, what you have to do is, whatever things which are high yield and you frequently forget, just make a note of those things and then keep on revising those things which you think that you forget frequently, right? Have a good night's sleep just before the exam day, because sleep is very, very important. Visual impression is very important. From now on, start revising things, because revision is the key for success in MCQ exams. Without 3 revisions, nobody, ideally, in the ideal scenario, nobody can crack the exam without 2 to 3 revisions, right? Okay. Yes, there will be a important session, another important, a video will be released regarding the important tables in pathology or high yield things. Pathology is a very high yield subject. Somebody has asked me which part of pathology is high yield. See, pathology as a whole is a very, very high yield subject, students. You can solve medicine, surgery, MCQs by pathology also. So, there are certain topics which I have told to the students in the app that these are very high yield, like for example, apoptosis, amyloidosis. There are n number of topics. I will release another video on the app regarding all the important tables which you have to remember, the CD markers, the stains, the important tumor markers, and the important bodies in pathology. That video will also be released just before the AIIMS exam, so that you can quickly revise. So do not worry about that. See, regarding the image based questions, what happens, students, is that it depends upon the examiner's mood. They can ask image based questions from surgery, from medicine, from pathology, and from radiology. So it depends. Normally approximately 4 to 5 questions are usually asked from pathology image based, but it depends upon the examiner's mood. Like last year in AIIMS exam, there were approximately 49 image based questions, not just pathology, overall, right? Okay, so inheritance pattern using pedigree chart, students, I have already shown you in my video on genetics. CD marker table, I will soon give you, students. That video will be released. Please be rest assured. Okay, a very good question has come up, how to study all the subjects in an integrated way. Yes, it's an important subject, especially students, paraclinical subjects like pathology and physiology. You have to do clinico-pathologic correlation. Without clinico-pathologic correlation, you should not study. So for systemic pathology, what I tell students is that you pick up your medicine notes, pick up your pathology notes. If you're studying cardiovascular system, pick up your medicine notes, add the biopsy findings and the important pathology related things in the medicine notes, because obviously the medicine notes will be vaster than the pathology notes, right? So keep on adding them, so that just before the exam, you have to remember one copy, not the 2 different copies, both from the pathology and from medicine, right? Important stains table will be soon there, students, do not worry. Hematology videos will soon be released. I have already told you n number of times that this video will be available to all the Marrow users soon. Important stain table I will give you, do not worry. Okay, flow cytometry images. In the next session, in one of the videos, I'll teach you how to study flow cytometry, right? How many genes to be remembered? See, it's a very tricky question which you ask me, how many genes to be remembered. There are a lot of genes. So what I will do, I'll make a table of important genes and their chromosomes and give it to you. Clear? So in the next session, what I will do after the same exam, students, I'll give you a video regarding the important images, or not the images, but the new updates or the changes in the 10th edition of Robbins, right? So that will also be covered. IHC markers you have to rectify because you do not practice the IHC markers. That is why you cannot understand them. You have to rectify the IHC markers. I'll give you a table for that. So in the student's question paper, you will be given that whether this is a bone marrow aspirate or a bone marrow biopsy or a peripheral smear. And you know, even when you see, I've told you the basics. How does a bone marrow aspirate look like? Or how does a bone marrow biopsy look like, or a peripheral smear, right? So that will help you to solve the questions. Somebody has asked me which in hematology what are the high yield points. See, hematology as a whole is a very high yield topic. You know, lots of questions are asked, especially clinico-pathologic questions. So the hematology you have to know fully along with the images, right? No, do not see Robbins images just before the exams. Whatever images I have told you, please do them. Do not see the entire Robbins images just before the AIIMS exams because you will get confused. This video will be available on the app within the next 1 week. Yes, pathology is all a clinico-pathology. It's all clinico-pathologic correlation because the examiner wants to test your general knowledge these days. So you have to correlate pathology with the medicine subjects or the surgery subjects, right? So you have to understand the basics with that only. See, if you are not able to identify the image-based pathology slide, if you are able to make the diagnosis, 50 to 60% of the diagnosis just based upon the history, then please mark the question. Please mark the questions, right? Important, everybody is asking me important stains. You know, in one of the videos which I have released for general pathology, I have given a table of important stains, but a video with all the important tables will soon be released. Yes, most of these images can be asked in your exams. Be rest assured that these 80 to 90% of the image-based questions will be asked from these images only, right? For AIIMS exam students, you have to focus on the images because AIIMS examiner has the maximum tendency to ask the images. So go through this, go through the images. Then there are a few favorite topics of the AIIMS examiner, like schwannoma is a favorite topic, apoptosis is a favorite topic. You know, there are a large number of topics. Amyloidosis is a very favorite topic. So you have to just quickly revise them. So for systemic pathology, many of the students are confused. What I tell the students is that again and again, systemic pathology, you have to study, students, how? By correlating it with medicine, surgery or gynae, right? So suppose you are studying female genital tract, keep your gynae booklet with you, gynae notes with you. Just keep adding the important pathological points or the important points which I tell you in the gynae notes, and then it will be done, right? Yes, I will make a video of important high yield topics before the NEET exam. Do not worry about that. Yes, one important thing which I would like to tell you, for question banks and previous year questions, students get confused and ask me frequently that, ma'am, which question banks or where do we do the previous year questions? Students, the Marrow question bank is 100% authentic, and it covers most of the questions of the previous years. So you can do the Marrow question bank and be rest assured that most of your previous year questions are covered, right? Don't go haywire, don't read any other book, don't go and just trust the Marrow question bank. I again and again tell the students that if you study from multiple places and do not trust one place, then it creates a lot of confusion and you are unable to revise the subject properly. Revision is the important thing. Most of the important game changer is revision, because if you do not revise and you just go by just simply reading it once or twice, you do not remember anything, right? So revision is the key, and for revision just trust one thing, keep on making notes and doing the questions and just go for the exam. Yes, this video will be available later. See, you have to know that these are the high yield topics and then solve the MCQs from those high yield topics, right? So it cannot be like you can skip many of the questions. You have to solve most of the questions. See, many of the questions which I am getting are very much like where it depends upon person to person's preparation. It depends upon your preparation whether you want to do the question bank or you want to do the live videos. It depends upon your the preparation which you have, right? Yes, question bank of pathology is enough for exam. I'm repeating it again and again. So solved questions mein what you have to do is whichever questions went incorrect, we mark in Marrow app, we mark the questions which were incorrect. So just go through those questions which were incorrect and go forward. No need to revise those questions which are correct. Strategy for studying pathology. Most of the questions from pathology which I have realized over the years are asked from general pathology and hematology. Very high yield, because in systemic pathology you can solve the questions from other subjects also. Focus on general pathology, hematology. Focus on those topics which are which are latest and the new genetic techniques which have been asked in the latest books. Focus on a few crammed up few things which you have to cram up, like the stains or the markers, because these days they are asked frequently. Focus on how to make a diagnosis in a clinical patient, right? And correlate it with medicine. That's the game changer. The transfusion medicine image will be released soon. Transfusion medicine image will be released soon. This video will be there for most of the users. Yes, many of the Pearl tables, the explanation of the Marrow questions which are there, that is also excellent. If you read the explanation carefully, they have given very of the high yield tables, right? So just remember those tables. Tables of interleukins will also come up. Blood products videos regarding the entire transfusion medicine will be released soon. So students, I think I have covered most of the questions, and this is it. I am repeating it once again, students, that this image, be rest assured, will be available on the Marrow app soon. A transfusion video and a transfusion medicine video and a markers and a table video will be available. Very high yield point video will be available for the Marrow users soon, right? Do question bank of Marrow pathology very effectively, right? Keep revising the important things or questions which you have marked wrong, and you will sail through.
right? Thank you so much, everyone. Thank you so much for your patient listening. See you until next time. All the best for your MCQ exams. Thank you.